I think we're ready. I know we were having some connectivity issues, but nothing related to this event, just in general. But I think those have been resolved, so we should be good to go. So good morning, everyone, and Happy New Year. This is the first session of Tech Topics in 2020. My name is George Linares. For those that don't know me, I'm CMS's Chief Technology Officer, so welcome. So we do have these sessions, 10 months. No, 7 sessions. No, 9. Because we take December and July off because people take vacations, and then in August we have the big Convergence Conference, which we're going to hold as well on the first week in August as well. The dates will come out and so forth. So, today we have we're getting started. So I just want to say that for 2019, let me tell you this, we had the highest. We broke records in attendance. So. Based on that, I'm seeing there is a lot of interest. We're going to continue having these, so give me your feedback, topics. I see more people reaching out to us with different topics and things that they want to do. One of the rules that we have is to be sure that whatever we present has to be in support of an existing program to CMS. That is the number one, because what we're trying to do is showcase some of the capabilities that CMS has and also the direction that we're taking in many of these areas, like the cloud, databases. There's so many activities you're going to see this year, IT governance, which you will find interesting anyway, and it should help you in your ventures and doing business with CMS for those that are in industry. Okay, so today we have 3 topics. We have business intelligence tools, and I know that one has. In 2019, they were not here, but I know they've been doing a lot of work, so they'll be our first topic. Then we do security and privacy policy. And this was an interesting one, actually, because we're doing a lot of work behind the scenes. And as you know, CMS is subjected to policies that come out of OMB, DHS, HHS, so we have a role to play here. So they're going to inform some of the things that we're trying to do to better sort of communicate those changes. And last but not least, we have AEM, Adobe Experience Manager, which is a product that is being used to support CSIO. CSIO is basically the organization or the center within CMS that supports the healthcare.gov website and all the different systems that go with it. So without further ado, I'm going to introduce the business intelligence team, Yusuf. Okay, and then Yusuf is going to bring his team to the front. Thank you.
Good morning, everybody. It's on. I see some familiar faces. For those of you that don't know me, I am Yusuf Shaheg. I'm the Division of Data Enterprise Services Division Director. As George said, we have been busy with moving some of the BI tools into the cloud and continue with the remaining tools. I'm going to introduce to you our main presenter, Donald Gu. He's the Chief Product Owner. Thank you for helping me.
New agile terms for everyone.
That's right.
And Kevin Boone, the SaaS user coach.
And Kevin Boone, the SaaS user coach. So Donald, it's you. And if there are any questions at the end, we all will be here with the rest of the BI team to answer any questions. Thank you.
Thanks, Yusuf. Everyone can hear me okay? All right, so good morning, everyone. I'm going to go over the BIA tools overview. The BIA is the Business Intelligence Analytics Program. The prime is Aprio. Let's see if my slide clicker goes. Next slide. This is the agenda I'll be going over today. The BIA points of contact for business objects. Mike Danko is the primary point of contact. For Cognos, Mike Danko is also the primary point of contact. Informatica is Gregory Birch. MicroStrategy is Mike Smith. SASE BI is Carlos Boris Martinez. Esri ArcGIS is Carlos Boris Martinez, and then from the BIA side, our BI tools manager is Sandy McCustis. What are the BI ETL tools? Business intelligence tools. They provide business components insight into users' data, allows them to analyze the data in a user-friendly visual manner, shields the users from the technical details such as queries, allowing the users to drag and drop elements to answer their business questions, usually in the form of reports, charts, and dashboards. The ETL part of that is the extract, transfer, and transform and load tool. It's used by developers to insert large amounts of data into enterprise data warehouse that extracts the data from a source system, transforms the data into meeting the business requirements, and then loads the resulting data into a centralized storage. What are the BI ETL tools used at CMS? Right now we have IBM Cognos, MicroStrategy, SAS, Informatica, and Esri ArcGIS. Other BI tools at CMS, the CPI component uses SAP's business objects for some of their reporting needs. Here, for your reference, within the slide deck is the BI ETL tool versioning. It's got all the current versions that are deployed within the CMS environment, but we're always constantly updating. Just last week, we've upgraded the Esri ArcGIS, so the slide is already out of date. We're now running at 10.7.1, so we're constantly trying to make sure that the tools are all patched and updated. Going into MicroStrategy and some of what it's used at CMS, it supports interactive dashboards, scorecards, highly formatted reports, ad hoc queries, threshold alerts, automated reports, distribution, along with visual insight. There's the Encounter dashboard that was built within MicroStrategy, which exposes Part C data very intuitively, visually, presentation to allow analysis without the need to write SQL. The project components are listed on the slide that currently use MicroStrategy within CMS. We approximately have 7,000 users. The concurrent user capacity is 100, and the user license allocation is limited. So if you are submitting a request to access the tool, please make sure your business justification is very clear in justification and you get approved to it since it is a limited license. Some of the sample applications and data sources that are being used are the CMS Performance Management System in Oracle, the Contractor Management Information System in Oracle, and the Part B Analytic Reporting IDR. The current system of MicroStrategy, the web-based tools are MicroStrategy Web, MicroStrategy Dashboard, and MicroStrategy Document. They also have the client tool of the MicroStrategy developer that's installed. It integrates within the CMS Enterprise portal. Most users of MicroStrategy at CMS are developers and report or dashboards consumers. It's deployed across 3 different environments: development, validation, and production. The enterprise external application infrastructure consists of 19 servers residing in the LMDC and BDC, running on Linux OS in an x86 platform. The licensing model is per core. SAS EBI. How it's used at CMS is its advanced analytics, multivariate analyst, business intelligence, data management, and predictive analytics. The 1PI program users perform statistically valid random sampling, advanced statistical analysis, and create temporary data sets for deeper analysts to support CPI's mission to identify, deter, and combat fraud, waste, and abuse in Medicare and Medicaid. The Office of Inspector General developers in the Consolidated Data Analysis Center have created multiple user-friendly tools to generate data and metrics that assist in deterring and preventing fraud, waste, and abuse in health and human services programs. Current tools including PAYGAR, Part B, Provider Profile, Trends Tool, and Peer Comparison Generator. CDAC uses SAS Enterprise Business Intelligence hosted at CMS as the main backbone for its tools. The components are listed on the slide that use it. Approximately 1,500 users across Web and Citrix. The concurrent user capacity is 150. Once again, SAS's licenses are limited, so this also applies as if you're submitting your request, make sure that your business justification is very clear so that it's very understood by the people that are approving it why you need in to understand the need for that. The sample data sources are IDR, Teradata, TMSIS, and MSIS, and then MQM. The current system is using Citrix Web Windows desktop client as well as a web enterprise portal. The web-based tools are the Web Report Studio, BI Dashboard, SAS Studio, and SAS Portal. Other clients' tools accessible in Citrix are the Enterprise Guide, Enterprise Miner, Information Map Studio, and OLAP Cube Studio. Most users of SAS EBI tool at CMS are data analysts. It's deployed in 3 different environments, development, validation, and production. It uses a new enterprise grid infrastructure consisting of 38 servers residing in the BDC, running on Red Hat Linux in an x86 platform. Servers support multiple tiers, including web application, compute, and metadata servers. Informatica. Informatica is the ETL tool, so it's the extract, transformation, and loading tool used in building enterprise data warehouses using different data sources within CMS like Oracle, DB2, Teradata, flat files, and mainframe files. The project components that are utilizing that currently at CMS, it approximately has 200 users. There is a limited set of license available for Informatica, and some of the data sources that we're loading into is the integrated data repository, as well as the Payco system. The current system, all Informatica clients are installed on the desktop. Power Center, Designer, Power Center Workflow Manager, Power Center Workflow Monitor. Developers must be connected via VPN to use it. It's deployed in 4 different environments: development, test, integration, and production. Enterprise application infrastructure consists of 7 servers residing at the BDC on Red Hat Linux on the x86 platform. Production ETL jobs are automated and executed by a production scheduling system. IBM Cognos. IBM's Cognos Analytic integrates reporting, modeling, and analyst dashboards, stories, and event management so users can understand their organization's data, make effective business decisions. One of the components, ACO, Shared Savings Program, allows users to view several different periods of data along with graphs. This data is used to create trending reports along with the ability to drill down from summary level data to actual beneficiary level. The project components are listed on the slide. Approximately 10,000 users of Cognos, either directly or through API calls. The system concurrent users are 100. It has an unlimited user license allocation, and some of the different applications and data sources are the medical appeal system, the provider statistic reimbursement, systems for tracking audit and reimbursement, and the enterprise eligibility services in DB2. The current system, all Cognos functionality is available over the web using Cognos reporting authoring, Cognos Query Studio, Cognos Analyst Studio, Cognos Dashboard. It integrates into the CMS Enterprise Portal. Most of the users of IBM Cognos at CMS are developers and report consumers. It's deployed in 3 environments, residing at AWS Cloud as of hopefully this weekend, or the end of the month. We are going through our final phases of doing the cutover for Cognos there in the development, validation, and production region. The enterprise application infrastructure consists of 11 servers. It's integrated into CMS's TRA compliant 3-zone architecture, and we're also utilizing Amazon workspaces and Okta multi-factor authentication for some authentication up front. Esri's ArcGIS. Esri ArcGIS Enterprise provides an AWS cloud-based enterprise solution that enabled graphic mapping analysis of the Centers for Program Integrity to help meet their business objectives of finding and reducing waste, fraud, and abuse in Medicare and Medicaid care. The ArcGIS tool uses data from integrated data repository that is enhanced with longitude and latitude points. The current components that are using it are CPI. It has a limited user count of 5 ArcGIS Developer Desktop Pro licenses, which are assigned to CPI users. We've got the web application capacity of 150 Crater and unlimited viewer licenses and types, and ArcGIS Pro license available within Amazon's workspaces. The data sources are the IDR. It's accessible through Amazon Web Spaces and the Web Enterprise Portal. This is the portal within the ArcGIS component, not to be confused with the CMS Enterprise Portal that some of the other tools use. The current ArcGIS system is a hybrid cloud on-premise model with ArcGIS for server and portal for ArcGIS base maps and are located on ArcGIS Online Cloud. Users accessing it via CMSNet. ArcGIS is not available on the public internet. Web-based tools are a web builder for ArcGIS, client tools accessible via Amazon Workspaces, ArcGIS Pro, ArcGIS Desktop, Web App Builder for ArcGIS Developer Edition, and the Teradata SQL Assistant. It's deployed in 3 different environments: development, validation, and production. The current system resides in AWS. As of this week, we just had our cutover this weekend, and it consists of 5 servers per environment, and those servers are listed included there. Provider and beneficiary geocoded data is stored in the IDR for CPI's workflow uses. The process to acquire access to these tools are pretty much similar for most of the tools. It does require a prior GTL approval required for any request of 3 or more users per project or component. Your CAA can submit the request for user to either EUA job codes or EIDM roles to obtain access. Separate job codes are required to access the databases. As I'd mentioned earlier in the slides, when you're filling out the business justification, please make sure you're very clear on what you need access to the system to do, because some of the tools do have a limited user license set, and we do have to monitor the number of users that are in the system and have access to the system. Developers must have an approved VPN access job code and have CMS 4-character user ID to access the tools. CMS component project lead must complete a project initiation form and submit for approval by CMS's DDES tool GTL. Component will need to acquire disk storage through OIT IUSG via service request to establish a project for both SAS and Esri. The tool administration team coordinates activities to connect data warehouses such as Teradata, Oracle, and DB2, and access via EUA and EIDM access. BI tool training that's available for SAS. There is a bi-monthly SAS business analyst training provided by a BIA administrator contractor. There also is SAS user coaching available on a one-on-one assistance basis. Kevin is one of our user coaches. Training videos available on SharePoint page. For MicroStrategy, there is some vendor-provided training for that, but you do need to reach out to coordinate that, as well as some training videos available on the SharePoint page. Cognos has training is provided on an as-needed or requested basis. Future initiatives that we're working on is Python within the AWS cloud. We've recently rolled out an image we've currently got some developers testing within AWS to see if it's going to meet their needs and what they could do with access to Python. We're also investigating whether a SAS instance in AWS, what that would look like and how we could deploy that. Informatica is also currently underway with a AWS migration and seeing if we can deploy something there and how we would utilize that. And then Business Objects is currently underway with a Solaris to Linux migration, hoping to have that cut over for CPI in production by Q2 of this year. As part of the new BIA contract, we've had to move into adapt a agile, safe methodology for DevOps. The DevOps is an agile approach to bridge the gap between development operations with the goal to delivering value faster and more reliable. We're following the COMMER approach of culture, automation, lean flow, measurement, and recovery. Within AWS, some of the capabilities we're hoping to be able to expose as we're moving forward is the BIA internet URL, allowing users to access it and render any of the BI tools there, as well as providing some multi-factor using Okta. We've got our operation intelligence using Splunk and ITSI for some root cause issues within seconds. AWS Workspaces allowing us to provide personalized Windows and Linux virtual desktop environments to connect to CMS's backend data sources, improve security, Patching management, we're looking to implement to help us with the patching of both the servers and the applications within AWS, as well as data replication across the data centers. And we successfully deployed some real-time replication process using AWS's DMS service. The tool admin server authentication implemented detailed the process for setting up public and private key usage with AWS and AMI. I know this is the question slide, but on the conscious of time, I'd like to move right into our some of the demos we have, and then we'll go back and take some the questions after that, if that's okay. So we have a video here that was put together by the Esri vendor just to give some ideas of what visualizations you can do within Esri ArcGIS and bringing that data in. This video will demonstrate that you can take data and data can be loaded from local sources. In this case, we're using a provider Excel file. It can be, or it can be imported from the web like ArcGIS Living Atlas. There's also data available from another 3,500,000 organizations using ArcGIS. It can convert addresses into points on a map using ArcGIS's geocoding. Esri's geocoding is accurate and fast and easy to use, even with large data sets. So it's going through and highlighting the fields, matching up the fields with the geocoder so it can geocode that data. And this is where it gives myself a chance to break and not talk as much, because the video can do some of the talking for me. ArcGIS Online and ArcGIS Enterprise allows users to add descriptive titles and summary descriptions and terms of use. It also allows users to mark items as authoritative, so other staff members use the correct data sets. Users can also track the usage of their items over time. Choose a recommended design style from Esri's Smart Mapping, or select your own custom symbols and colors. Esri also supports multivariant symbology to show predominance and relative relationships. In ArcGIS Pro, you can add data with a time field to visualize in a time slider. Data containing a to field and a from field can be added to a link chart. Scan massive data sets using selection tools. Select using a chart or by entering a query. Leverage ArcGIS Pro's massive toolbox for spatial and statistic analysis to find outliers to make predictions. If custom tools are needed, ArcGIS Pro integrates directly with Python and R. Data uploaded to ArcGIS Online and Enterprise is interactive and can be used on all devices, including mobile, with no added installations. ArcGIS story maps are included as a tool to add a guided narrative to your data. As the story advances, the map content and view will change. By default, content shared on the ArcGIS Online and Enterprise is shared with no one. Easily select desired items to share with custom team, an entire agency, or to the public. I'll move on to our next demo for MicroStrategy. This demo was put together in an hour just to quickly demonstrate how quickly you could take data and import it into MicroStrategy. This data was using MicroStrategy Dossier with the Esri Cloud integration for the map in the background. It's using publicly available data from data.gov on 2013's Medicare Part D opioid prescription summary. The map is showing the number of opioid prescribed across the United States by zip code, opioid prescribing rate, total claim count, opioid claim count, NPI, and specialty. Users have the ability to further drill into any pie group. We can also show that we can change the map styles to go from light gray to using satellite and switching back to the street map that we're here. We can also change the layers that are being displayed in the map. In this case, we have both zip and state. We can toggle to the state and disable the zip layer and navigate through the map to show the aggregated opioid prescribing rate by state. We'll turn back on zip. And then now we'll show a density map. And we'll proceed to filter the data by a specialty to analyze the data dispensing rate for dentist in this case. Once that's being displayed, we can then proceed to adjust the opioid prescribing rate to look at providers who are dispensing a certain percentage of their total claims as opioid to their patients. Using the same filtering conditions which were set in the density map, we'll switch to an area map by zip code for Florida, and we can adjust the opioid prescribing rate to show all the dentist facilities in Florida by zip code and look at the distribution of opioid. And as I said, that was data that was imported from publicly available sources into MicroStrategy within an hour to build a quick visualization to start looking at questions that you might have interest in. So I'll hand it over to Kevin so that he can take us through the SAS slides.
Thank you, Donald. Using SAS Enterprise Guide from the perspective of a business analyst who is going to be perhaps closer to the data than some of the people using some of the web-based tools, I wanted to present this use case that is straight out of our training for the SAS ABI system. This class is offered to CMS employees and contractors. on a bi-monthly basis. And at the end of that class, all the students have a task to answer this business question. What was the inpatient admission rate for lung cancer diagnosed patients who were continuously enrolled in Medicare for an entire year in a specific state? If that sounds like a mouthful, it is. There's a lot of parts to that question. And you can see here, this is what we call a process flow in Enterprise Guide. Now, if someone wished, they could open up a code window in SAS and type one long query to answer that question. But that's a very complex query. Sometimes with such complex queries, it's easier to visualize each step of the process. For instance, that top branch, how do I determine continuously enrolled beneficiaries who were enrolled for at least a year? Then also, how do I address a specific state, in this case, Ohio? How do I find lung cancer claims? This process flow makes it easier to visualize all the steps along the way until you get to the right and one final answer. For this case, we were looking at Ohio in 2013, and we found there were 7 utilizing beneficiaries. Now, one caveat, this was done against data and validation, which is not the complete set of data. I would not go basing business decisions on data that's in validation because it's not the complete picture. This is really just validating that the process worked, but this is how you would find that answer. So we have an answer for one state and one particular location. And I did fail to note, the source data for this entire query was the Integrated Data Repository, or IDR. So this is SAS integration with the IDR to answer this particular business question. My background is actually in mapping and in GIS. I came to SAS 10 years ago by way of a business acquisition. So I started out as a map maker, which means anytime I see data that has a geographic component, I want to see it on, Kevin's jumping ahead of himself here. This is what a query builder looks like within Enterprise Guide and tables and joins. So instead of typing code, this is how you visually build a query within the SAS software. My apologies. Now, to the pretty part, the maps. I wanted to take that answer a step further and look at Federal Region 3, which is 5 states plus Washington, D.C. in the Mid-Atlantic region, and compare that data over time. And that's what this map shows. SAS is also integrated with the Esri server here at CMS, so the same base maps that you saw in the previous demonstrations are available for use in SAS. I happen to choose this particular one because it shows state boundaries very well for this particular map scale. So here we have a bubble map showing on a state-by-state basis, including DC, how many lung cancer admissions per 100,000 continuously enrolled beneficiaries. That's 2012. What's it look like in 2013? Well, not too much different. 2014, a little bit different. You'll notice when we get to 2015, a drastic change in Washington, D.C., and a slightly less drastic change in Pennsylvania as I flip back and forth between them. Looking at data on a map like this can often lead to other questions, other insights. Why such a drastic change in Washington, D.C.? Was it because of a policy implemented, or was something else going on? Was there a mass outflux of beneficiaries from D.C., for example? So looking at this data, again, starting with it in the Integrated Data Repository, querying it through SAS to get insights into the data, and then visualizing it on a map can help lead to better policy and better understanding of beneficiary and claims data. I think we're ready for questions now. I'm not going to try to flip back to the questions slide.
Okay, any questions? And actually, what we're doing questions, let's do the live poll. That's something that I forgot to mention earlier. As a way to improve, we want to hear from you in terms of what's working, what's not working. So that's our text. And then, as you can see, business intelligence is evolving with SAS, the GIS, and we're trying to move more things to the cloud. You're going to hear that more and more throughout these sessions. So let me open it up on the phone. Any questions on the line? No? Okay, in the room?
No questions at this time.
Thank you. What about in the room? Everybody's too impressed. Everybody's like, yeah, we're with you. We're with you. Yes? No? All right. But if you do,
I think we've got
oh,
a question
please,
back
if you can step up to the microphone, that will be great. There is one question.
Hello, IRSG Osora. While this is all being used for the components and out in the regions trying to identify beneficiary information, do you guys have any office level components that are using Power BI or any other kind of analytics to be able to track compliance against the CFR, for example?
A lot of the reporting is built by the different components, so I can't talk to that directly. We're just providing the tools, and these are some of the projects we're aware of that are being used within the tool.
Yes, so just to expand on that a little bit. So what you've seen this far, right, is the offerings that the enterprise is offering, in essence, right? So we're funding these services. There's a whole operational server base, so you come in, you get the access to it. What the products you generate out of them is, it will be different across each center, each office, each line of business, however that works. Now, these are server-based products. We also provide or allow access anyway, like Tableau, for instance, right? We don't have an enterprise version, but if you want to use Tableau and use the desktop version, you can do that too. And then you can generate all the reports. I think Power BI, I don't know if that's something that's available or not, but I mean, this is just the enterprise offerings that we have today, if that helps. All right, no other questions? All right, I want to say thank you to the team. All right. Then the other thing I wanted to mention, okay, so while the team, so next topic is going to be inform, I got to get it right. Inform security and privacy policy. So I'm going to ask the team to come up, the presenters. And then while they're setting up, yeah. While they're setting up, just so you guys know, I saw a question pop up around the materials. So all the materials are going to be available in zone.cms.gov. That's online, so that's available to contractors. You do need to establish an ID. If you need to have the instructions and things like that, just go to Twitter and look for the handle CMS Converge, and all the instructions should come up. Okay, I'm going to turn it over to Mike.
Hi, everybody. Going to change the kind of discussion here a little bit from a technical discussion, but more of a cultural and organizational discussion. My name is Mike Poggles, and I'm in the Information Security and Privacy Group, and also the Acting Senior Official for Privacy. And we're here today to talk to you about our informed policy strategy around security and privacy. And I have a panel here. I'm going to speak a little bit to what we're trying to solve through this informed policy so you get an understanding. And then I'm going to ask the folks a question so that you can understand how we're actually going to attack this, right? So with me today is our policy lead, federal lead, Clarence Mayfield. Everybody knows Clarence. If you have a policy question on security, you call Clarence. Purba, Daria from MITRE. MITRE supporting our development of this process. From our Unison is Charles Amoko. Thanks, Charles. And from Ironvine is Leslie Nettles, who's our support from Ironvine on our policy group. So what is it that we're trying to what is it that ISPG does, and what are we trying to solve? So ISPG, Information Security and Privacy Group, we have 3 divisions. One division does security operations. So we're looking at all the traffic going across and that type of thing. Then we have our division of compliance that issues your authority to operate, that does our acceptable risk standards. You go through that process, you get an ATO, right? And then we have our division of security and privacy policy. Which we represent here, right? So one of the challenges that ISPG we're trying to solve is, how do we work across our 3 components, get more synergy in terms of how we're working with the business components, right? One of the things we realize is that in the past, we have not been necessarily looked at fondly, right? Because we've been basically talking down to the components and say, hey, we've got these security and privacy policies and you need to meet them. And so it's pretty much been a top-down approach, but why is it a top-down approach? Well, to get a little bit defensive, it's because OMB, HHS, Department of Homeland Security says, thou shalt, right? Thou shalt do this. You will put in the security posture for your agency, and you will implement it, right? So I walk up to George Linares' office, and I say, hey, George, how things go? And he goes, Mike, why do you keep adopting policies that we can't implement? And I'm like, give me a break, George. You know that this is being demanded of us. We have to do this work, right? And he goes, Mike, what are you doing? Why are you adopting policies that we can't implement? So the same question comes back, right? Okay, George is a CTO. We have a challenge here, right? In 2018, we reached out to our human design project to hear from our customers what they thought of us. And some of the feedback we got was, they need to explain what they're asking for. They're not real happy with us. We're the policy group. And they're like, what are you asking us to do? You're throwing stuff over the fence that requires funding, and we don't have any money to do this stuff. We can't do it. Normally, this is a one-way communication. You're telling us what to do. We don't participate in that discussion about how we're going to implement. And we spend a lot of time worrying about this with unclear guidance. Now, I can tell my buddy here, Clarence, is just really clamming up because, he's been involved in this over the years, and one of the things that he's required to do is get policies out. And we've done a really good job of getting policies out. What we haven't done is thought about how we are working with our business to actually engage with them and help them plan about how they're actually going to implement these things. So, this is not rocket scientists. We like to think that we are trying to be innovative. We're trying to be customer-oriented and thinking about, okay, what do our customers need from us, right? So, just real briefly, what ISPG does is we publish the information security and privacy policies. We publish the acceptable risk standards, which are NIST requirements, right? And we also do risk management handbooks. So that's basically what we do. So go back to the prior slide real quickly. So, what we saw was, and what the challenges were, is that policies can be difficult to execute at a technical business level. That we have limited resources. Many of these things come down, they're unfunded mandates. We know that our stakeholders perceive they have little ability to influence. Probably they do, in fact, have little influence because we're required to do it. There's an implementation gap. There's no guidance for business owners on how to implement. There's a lack of enterprise solutions. Okay, so what are we doing? So what we're doing through this informed policy is really looking to engage across the enterprise, both the business, our technology folks, to come up and say, hey, you know what? This is coming down the pike. How do we start talking about this? How do we start looking at our acquisitions in the future? How do we start budgeting for these things? How do we think about, how do we improve our risk posture? Because you want to know what happens right now? If we can't implement it, what happens is it goes through an authority to operate, right? There's a finding, and it gets put over in a drawer somewhere, and every 3 months it gets looked at, and somebody goes, yep, extend it. So what you end up with PHI and PII in lower environments for how many years, and nobody's dealing with the issue, right? So the idea is, let's have that conversation. Let's bring it out in the open. Let's be transparent. As George Hoffman would say, our acting CISO, let's be intentional about what we're dealing with and come up with some solutions. So what informed policy is intended to do then is that it's intended to promote collaboration. And we're going to get into, and I'm going to ask the panel about how we're going to do that. We're trying to limit the adverse impact. Are we going to really be able to do that? Probably not. But through these conversations, we're going to be able to start planning. We want to account for the impact to the existing processes and environments, trying to think about how do we minimize risk. I like to use the analogy of if the county government told you tomorrow that you had to have sprinkler systems on the second floor of your house, you would say, okay, man, that's going to cost me some money. That's a tough requirement. And then you would think about folks that maybe don't. They're going to have to choose between buying food or putting sprinkler systems on the second floor of their house. Okay? I know it's kind of maybe an absurd, just hang in there with me, right? But maybe what we want people to say is, you know what? I'm going to admit, I can't put sprinkler systems. I can't afford it. My environment doesn't permit me to do that. But what I can do is I can put fire extinguishers in the second floor. I can have an exit plan for my family should there be a fire. I can maybe have a ladder that gets my kids to from the second floor to the first floor. Now we're starting to think outside the box. Now we're thinking not just about what the requirements are, but how do we meet the spirit of those requirements and start putting our risk posture in a better position so that the agency can run its programs. So that's really what we're talking about. So anyhow, I want to start, I hand this over to the team here. Apurva, I want to start with you. If we can go to the next slide, please. So this is now the how we're going to do this, right? So talk to me a little bit about this slide and what we're trying to get at.
Yep. So with informed policy, the main thing we want to push forward is more stakeholder engagement and more talking to the internal components, external agencies, before a policy is released, right? So they have some influence in the outcome, and they're also more aware, like you said, of what's coming down the pipeline. So we can dive into these a little more.
Yeah, so what might be a trigger that would get us thinking about engaging Apurva? Is there, Clarence, thank you.
Triggers could include anything from an O&B mandate. It could be a new policy coming down from the department. It could be a new requirement coming from DHS. There are a number of triggers that we would take in and take a look at and identify, what is actually the threat here? What do we actually have to do in order to implement this requirement? What are the things that we have in place, or what's the impact? What do we do, and how do we get this out to our community without having a heavy burden on our community?
So Clarence, I want to ask a question on this. So we have a lot of different business lines. Center for Medicare, Medicare Fee-for-Service, the MACs, how they implement something versus, say, CPI or other components. So will every component need to be work with us when we have a new requirement? What are we going to do at the front end to help kind of work through what's important and what isn't to the components?
Well, one of the things we do in the very beginning is to identify who are our stakeholders and how does this particular how does this initiative impact them. One of the things we are doing, and Apurva will talk about a little later, is digital identity, which is a new requirement that's come down. We sort of identify who does this initially impact? Who will actually have to pay money to implement this requirement in order to be compliant with something that NIST said that this is how you're going to do it, and O&B said you have to do it based on what NIST has said to do. So we try to engage the folks that it impacts early. We look at the cost consideration. We look at the timelines that in order to implement it. But there's so many things that we can do in order to implement a policy properly without it actually impacting the organization to the point where we get a lot of, no, we're not going to do this. We can't do this.
So, Apurva, talk a little bit about, Clarence talked about triage. Can you talk about that a little bit?
Yeah, so Clarence kind of mentioned what goes into that, but what the main idea with triaging is we're using our subject matter experts, talking to people just very initially to make an initial idea of what that impact will be, who are the communities of interest, who are the people we need to talk to, and try to do that very quickly as soon as we have a trigger so we can move right into that proposed change phase. It's really just formalizing that process of identifying what's the issue, who do we need to talk to.
Yeah, and I think today, I think the difference today is that we've attempted to do that. Generally, a policy will come down from the department. We put it through SWIFT. We try to get input from folks about it. And I think the difference here is that we're trying to understand for ourselves the impact, right, and then engage those business components and get them thinking about it. So part of it is for their planning as well, right? So when we have a proposed change, Leslie, what documents or policies would be changing? Like if we go out and we talk to folks and they give us that feedback, what can we actually do with it? Is there something we can do with that information?
There's actually a couple different things we can do. We might not actually be able to change the policy, but we could keep it at a high enough level to meet the spirit while also updating the ARS for the guidance to implementation.
The ARS are the acceptable risk standards, so we could update that. How would we update? Is there a way to
Like within the supplemental guidance for the controls, to the business owners on how to implement that control, what's going to be looked at when it's going to be tested. Also, as we're writing the RMHs, we can use that information to help guide systems.
RMHs are,
Risk Management Handbook.
which are procedural documents. that-
Procedural documents for each of the control families to meet the requirements that are listed in the ARS. And once we have those, once we see what needs to be done to implement some of these new policies, we can incorporate it there to make it easier for the business owners and ISSOs to meet those controls if it's a control-based policy that's coming out.
So I know people on the phone and probably people in the room are going, yeah, it's a lot of talk. You guys, it's just you're still going to have the policies, you're engaging with us. But I think, in fairness, right, because we haven't had that discussion and around these things that are coming, we really haven't given ourselves the opportunity to really engage in a way. We may ultimately not be able to change a policy or a standard, but the way in which we explain things, the way in which we understand the risk, both from an enterprise level as well as how that gets communicated and worked through by the components themselves, we hope will add a lot of value to the process. So, through this process, CMS stakeholders directly participate in developing, approving, and implementing changes to cybersecurity and privacy policy through considering the impact, facilitating the translation into implementation and technical requirements, leveraging CMS existing planned enterprise solutions, which we're going to talk about, which is being led, one of these efforts is being led out of our CTO office, and then managing funding and resource constraints across the agency. I don't want to say that this is going to answer all of our problems and it's going to make implementing privacy and security so much easier, but give us credit for being intentional about what we're trying to do, right? I think this goes a long way. We really are going to make this effort to be more proactive in how we communicate with our stakeholders. Speaking of stakeholders, Clarence, go to the next slide here. Talk a little bit about this slide and kind of who are the stakeholders that we're talking about.
Well, Mike, the stakeholders are really our bread and butter here. You said the word intentional. So when we're speaking of stakeholders, I like to identify it as intentional engagement. We understand who our stakeholders are. We have a plan to go in to speak with them with regards to what we're looking to try and do. Now, our stakeholders could include anyone from our ISSOs to our business owners. We could be even outside of CMS, where we're talking about possibly looking at other optives and seeing what they're actually doing with regards to their implementation of new policies. We could also talk about the department, how we can reach out to the department to actually really, in some instances, really influence them in terms of how a policy can be implemented. So if we're talking about the department, it's important, I think, if we're talking about engagement, it's really important that we understand how everyone is doing it, how our optives are doing it, how the department wants us to do it. Then we start to take a look at our internal components, such as the ISSOs and our components. So I think it's important that we look at it from that perspective.
So I'm going to, somebody's trying to get a hold of you. It must be your policy back call. So I see we have like the Business Operations Council on here. That's a group, I believe, a council that deals with budgets and contracts and things like that. So what would why would that be of interest to them, do you think? Or what we're trying to do, Well,
I think we're looking at costs and understanding the impact of cost on the agency.
But also getting it in front of these groups, right? So
right.
that they can start planning.
Exactly. Right? So when we're talking about engagement, we're talking about, we really want to sort of cast a wide net and sort of identify the roles that actually, in organizations that actually that can actually impact the implementation of the policy. So even looking at engaging with OAGM, understanding how can we actually implement contracting language to actually impact the implementation of a particular policy. If we're looking at the SPMC, we look at SPMC as an organization where we have all top-level managers that have an influence over the agency as a whole. So if they have an understanding of what we're trying to do, they can talk to their components, they could talk to their divisions, their groups, and say, hey, we understand this policy is coming. Let's start thinking of a plan to implement. If we're looking at specifically OAGM, you start looking at contracting language, or looking at costs. Because if you start to look at costs, most business owners start to cringe when you start talking about, hey, we have a new policy that's coming down. The first question is, what's that actually going to cost me? Do I have the technology to actually implement it? So if you're looking at implementing encryption on a mainframe or something to that nature, you may have some may cringe on it, but you say, hey, I can't do that. So we want to try and figure out those parties that are impacted or that have some influence on our implementation.
So I see we have TRB here. We kind of work with TRB. My impression of TRB is that when they talk to business owners, they help guide them, right, towards, so I guess working more closely with the TRB to make sure that they understand what's coming down the pike. And I think in most instances they do. I think they do a fantastic job, but that's another partnership we would be looking to improve.
Exactly, because if you look at the TRB, you're also looking at an organization that has influence on the technical reference architecture. So if you start to look at the architecture implementation, you start to talk to those folks that have influence on how they're developing those requirements that actually have an impact on your system development. So how we implement those particular business rules within the technical reference architecture has an impact on how the policy will be implemented. So in talking with the TRB, they're really sort of the folks that have that front end, those front end discussions with business owners. Business owners go to the TRB to get information, to present topics of discussion that where their systems may be having some sort of issue. The TRB is where they go. So you have that front face with the TRB, and they have that engagement with the components. That's a win-win for everyone, because now the TRB has sort of been empowered to have an understanding of what the technical reference architecture will actually be, so they know what it is, so now they can influence the components in their implementation.
Okay, so I think we kind of get a good feel for what our intent is behind that stakeholder engagement. I wanted to thank you, Clarence. I wanted to ask Charles. Charles, I think we're doing something with the CTO's office. I don't know if it's I don't know if you have an office, George, but you know the CTO in terms of, I think it has to do with encryption, right? So we've kind of looked at this as almost as a model of how we might approach informed policy when it comes to an existing policy and how we might go about talking about it. Can you give us a flavor of what's going on with that group?
Thank you, Mike. With reference to encryption and existing policies, we just want to use encryption as an example. ISPG has been an active member on the CTO and Nobilis project on encryption, and the role of informed policy is one, engage our stakeholders, our components, business owners about what's in the pipeline for encryption, get their feedback, and incorporate those feedback in the process. And secondly, update the supplemental guidance of all the encryption controls, specifically SC8, 28, 12, 13, and 17, to reflect the results of the CTO and the Nobilis project so that the security and the risk posture of CMS will be improved.
Yeah, so George, I don't know if you knew that, but we were, that's part of our informed policy, right? We're looking at something, and I think part of what that work group's looking at too is like, does encryption apply equally across the different business lines? Are there opportunities, or not opportunities, are we overemphasizing encryption, and when in fact we're not needing to encrypt sensitive data, right. Why is it even becoming a requirement, right? So again, trying to be more transparent, more intentional, and helping our business understand those requirements. We really want to get away from just checking the box, hey, I met the ARS control, I got my ATO. or I got deficiencies over here, and really engage around what it is we're trying to accomplish. And George Hoffman has been, as our acting CISO, has been, I don't know, I mean, the thing that I've taken away from George and listening to him speak about risk is that, you know, let's know where our risks are. Let's not just say, hey, you know, check the box. Let's really try to understand what our risk posture is as an agency and how we can improve upon that. And we believe that through these conversations that we're going to have, through this informed policy process, it's going to move us closer in that direction. So that's really what we're doing. Apurva, I know we're getting close. We probably need to give you a little bit of time back, but I think we're okay. But Apurva, digital identity. Clarence mentioned digital identity. I think that's a new thing coming out. What is digital identity, and kind of like, why is that a good one for the agency to kind of put their arms around?
Yeah, so we're kind of piloting digital identity as part of informed policy to help improve what we're doing with informed policy. So the idea with digital identity is OMB directive emphasizing NIST 863 digital identity guidelines, a new version that came out. So many of the internal components are meeting the standards of the old version. So what we're doing is meeting with internal components, so that's groups within CMS that, you know, work on quality, innovation, the marketplace, meeting with other agencies like IRS or SSA or VA or even NIST itself to get more information about how other agencies that have the same requirements are implementing these policies. You know, and there's a lot of different groups listed on this slide here, and I think the main thing we want to get across is from privacy and security issue to issue, there might be different groups that we meet with, right? So we've met with those. We're going to continue to meet with those. We even met with Cedars-Sinai Medical Center because we learned that they're currently implementing a NIST pilot. So we wanted to learn more about implementing digital identity in the healthcare setting and what issues might come up there. And eventually we want to take what we learn in policy and take that to some of the groups that we have in this graph here that have a little bit more interest in the outcomes, authority to influence the outcomes. So that's how we're going to get the message across of what we're learning and what's coming down the pipeline and how we can implement this policy in a way that's more implementable.
Yeah, I mean, again, and I guess I'll be a little defensive here in defense of policy, right? We have to have policies. Our auditors will come in, we get audited, and they go, hey, where are your policies? Are they up to date? And yeah, we want to show that, yeah, we're up to date on our policies, but we're also being realistic about our implementation. And to the extent to which we can help document how we're moving forward and implementing some of these provisions, that's really going to take us a long way. I think it's the right thing to do. I think our acting CISO thinks it's the right way to do, and so I just want to emphasize that. So I'm going to let you take this next slide, Purva, in terms of next steps with digital identity. This is our last slide, and then we'll conclude. But
Sure. Yeah, so for digital identity, we want to complete that stakeholder engagement. So that's meeting with some of the groups that you saw on the previous slide and just learning more, learning the pain points of implementation and learning how we can improve it. And then, you know, we're going to put that policy together, get concurrence from the ISPG and the executives like the CISO to see if they agree with what we've put together.
so I do have a question now. So what would our engagement look like? What can folks expect to hear? Will we get a call from us, from ISPG, to say, hey, we want to talk to you about something, or will we have forums for them to come and make available to them? I guess we're going to both reach out to stakeholders as well as ask them to come and give us information. I think we're still learning that engagement piece of it, right?
So we have. You want to take it? Or?
Well, we have multiple ways that we'd be actually engaging with the organizations. One may be a survey. It may be we decide to sit down and have a meeting with an organization with regards to the policy or the initiative. There could be multiple ways of gathering data. And we'd use that data, as we sort of discussed earlier, we'd use that data to provide a specific requirement or develop a specific requirement that can be used by the organization, by the agency. So it could be anywhere from a survey to a meeting and discussion, but understand that when we do reach out, we have a plan in place. We're not reaching out to waste anyone's time. We're reaching out to gather specific data to help to influence in terms of what we're trying to do or what we're trying to accomplish for the agency.
Perfect way to end that, Clarence. Good words. George, I think we're ready for any questions anybody might have. Thanks for your patience. I hope you understand what we're trying to gain here, and happy to take any questions that people might have. everybody loved that discussion, right? That's great. Yay.
Anybody on the phone? So I just want to sort of highlight a couple of things that they said, all right? So policy, we can't get away from it. I mean, we're a government agency, and we have to have policies in place. I think where we have an opportunity to make a difference, that's what the team is trying to do, is how do we go about implementation? That's where we have the flexibility. And working with the CIO, working with the CISO, the acting CISO, we're trying to sort of really come up with a practical approach, because CMS is an operational, agency. We have so many programs, so much IT, and everything that a new policy, like for instance, they brought up encryption, right? We talked to Gartner. Gartner is telling us that no one in the federal government is encrypting 100%, private industry or government. So, okay, so we get that because, the cost is just so, it would be so huge just trying to encrypt everything that we have. Performance, but at the same time, we got to sort of improve the security posture, right, of all our systems. So this is just a little prelude because there is a presentation for Tech Topics to talk about encryption and the approach the CMS is taking, which will be sort of like a follow-up to this discussion so you can see how we're trying to sort of change. Policy is policy, but how do we implement it? What does it really mean to CMS? And I think we want to take an empowerment out of that and work with the department and any other government agency and say, this is what we're planning to do. We feel for all these different reasons, doing some analysis, that approach can still meet the letter of the policy, right? So, and that's what we're trying to do because at the end of the day, all of us have to change. So anyway, you'll see more about encryption and what we mean by it, because that's a good example when this policy has been in place for a couple of years. And there's some action in there, but it hasn't been a lot of action moving around. And we need to really get on it and try to really bring the agency's security posture in, stronger and lower the risks that we have. So that's what we get. Okay, thank you. I want to say thank you guys. Thank you. So the other thing that I wanted to mention, what we're changing here, and I'm going to invite the Adobe team to come up as well as the New Wave team to talk about the Adobe Enterprise Manager or Experience Manager, is that we have a new service, Granicus or Gov Delivery, which is a way for you to subscribe to Tech Topics notifications. Because we're trying to move away from, creating distribution lists. That's just because we've learned that industry keeps moving around between companies, so it's hard for us to track of all the emails. So instead of us keeping track of your emails, you can keep track of our communications. So this is a service that is available. You subscribe to it, and whenever you subscribe to the topic, you get notifications on what's going on. And there's a tweet about that, so go to Twitter, go for the hashtag CMSConverge, and you should be able to find all the information about how to get the service. Everything that we do, we try to tweet under CMS Converge, so hopefully that works. Are we ready with the team? Yes? Okay, so take it away.
Okay. Good morning. I'm Braun Jenkins. I'm the GTL for Adobe. So I'm a part of the Marketplace IT group. The Marketplace IT Information Technology group is responsible for providing information to support marketplace exchanges. The group is primarily responsible for the development, implementation, and operational security and oversight for the systems and applications that support the federally facilitated marketplace. And also, we provide technical support and security and privacy compliance for the trusted data sources, state-based marketplaces, and state partner marketplaces. We have a number of divisions, which are 5. The Marketplace Notice Production Services is underneath the Division of IT Development. The group director For MIT-G is Mark Richardson. The Deputy Group Director for MIT-G is Kate Weatherby. And the acting director for DMID is Claudia Brown, and deputy is Katrina Sizemore. So Adobe basically is in charge of generating around 3 million notices per month on average. It processes 4,000 requests on average per month for marketplace exemptions and appeals through smart PDF forms. And for issuer onboarding, it provides partners a smart PDF form that is electronically submitted. And lastly, it's capable of generating 1 million notices on an ad hoc or an as-needed basis. And with that, I'm going to turn it over to Gina Nolt from Adobe.
Good morning, everyone. I'm Gina Nolt. I am the Digital Experience Account Executive for CMS. And we're really excited to be here today to talk to you about AEM forms. So I'm going to read through the agenda that we have planned for today. We are going to be covering legislative and executive mandates that are affecting citizen and consumer expectations. We're going to cover the existing Adobe licenses owned by CMS that will support this, the evolution of PDF to online forms at CMS, features and benefits of online forms. Of course, we'll cover AEM forms. We'll show you an automated PDF conversion using Adobe Sensei, which is our AI tool, and machine language translation, aka localization, along with integrating online forms into existing sites. The consumer story, we'll show you a consumer story, and we'll close it out with some Q&A. Hopefully we have some questions at the end of this. Okay, so I think the ISPG group set us up nicely to talk about unfunded legislative and executive mandates, but we're seeing a trend starting with the 21st century idea, right? So a trend towards reducing paper-based forms, providing mobile-friendly options for forms, and increasing and accelerating the use of electronic signatures. So what's driving all of this? What's driving all of this, right? We as citizens are obviously also consumers, right? And our experiences in private sector are increasing greatly, right? We're just getting better and better. Obviously that translates to our expectations of our government. So paper-based forms are no longer acceptable. We're wanting to be able to sign things electronically, and we're wanting to use different devices to complete our forms, right? So mobile-friendly options. So with that said, we're here to talk to you about AEM forms, which is available to you now, and I'm going to turn it over to Sean, who will go over what's available to you.
Great. Thank you, Gina. So I'm Sean Hetherington. I'm with the Adobe Digital Experience team running professional services for the CMS account. And so you just heard a little bit from Gina about some of the challenges and expectations when it comes to modernizing forms. You heard a little bit about the policies and mandates. I'm sure those rang quite true for many people in this room and many of the programs. So how can you go about addressing these challenges and beginning to modernize your forms through AEM, through Adobe Experience Manager 6.5? George mentioned at the very beginning that the tech topics focus on technology or initiatives that are already in place at CMS programs, and obviously this is already in place within CSIO, within the Marketplace IT group. What we really want to let you know is that CMS-wide, this can be put in place because you do already have an unlimited license for Adobe Experience Manager, and so this is available to you today. You can get a demo today and begin modernizing those forms right away. Additionally, the professional services are already in place through our contract in partnership with New Wave under MIT-G, and so there are several years left on both of those, and we'd love to get in front of your programs as well. I'll pass it over to Wade now, my colleague, who is our technical expert on AEM. He's going to walk through some of the sexier capabilities of the tool and some of the new capabilities that were just launched.
All right. Oops. There we go. So what's being done with PDF forms at CMS? So first of all, CMS started what we call static print and fill PDF forms. And you might recognize these as your forms that have like the combed fields, the old-fashioned comb fields in the bottom left-hand corner. But essentially, these forms were designed to be downloaded and then printed, and then consumers would fill into their information into the boxes, and then be mailed in for scanning. So that was the old legacy form. Then we transitioned to what we call a dynamic fill and print smart PDF form. And this is a form that can be rendered in Adobe Acrobat or Reader or third-party readers. And as they fill out the form, the validations would fire. And after the form was passed all the validations, then all the data would be encoded in a QR barcode. So the goal is transition to something new, which is a web-based mobile adaptive form or wizards, which we'll explain a little bit more later. But these all have the same capabilities of PDF forms, so nothing goes away there. But they can be rendered on desktop, tablets, mobile phones, and other devices. And they can also be electronically signed and submitted. The important thing to note here is that PDFs aren't necessarily going away. They're just being used for the document of record, archiving, and in some cases for digital signing. So what are the features and benefits of online adaptive forms? Well, the big two that I can think of is it improves the consumer experiences and it reduces the abandonment rates. And so that's all where we want to get to when we were talking earlier about meeting the expectations on the consumers. You can build forms that can be rendered across any device, whether it be tablet, mobile phone, desktop browser. You can simplify the form fill process with what we call wizards, which guide users through a simplified TurboTax-like process. And for any of you that have filled out your tax forms on TurboTax, you'll notice that they kind of break up information into little buckets, and they make it easier to fill out. And that's where you want to get to help your consumers fill out their forms a little bit easier. Forms can be electronically signed and submitted across any device, including mobile phones. So you remember when you go and you buy, maybe go to Starbucks and use your finger sometimes to write your signature. You can do that too on your mobile phone. It contains all the validations and business logic of your existing PDF forms, so there's no limitations there. And you can also pre-fill forms depending upon logged-in user information or screen reader questions. For accessibility, the user can navigate a form using the keyboard only, and you can also take advantage of audible accessibility text that's read by most screen readers. You can use virtual keyboards to curtail the keyboard options on tablet and mobile phones. So the best way to think about this is if you're filling out a field and it happens to be your phone number and you're on a mobile device, you want to curtail the keyboard so it just shows numbers. So you don't want to show them the whole QWERTY keyboard, which makes for a poor experience. So there's support for cross-device form completion with save and resume. So the big thing here is that if you save your form, you start filling out your form on a mobile device and you save it out, you can go and resume that session on your desktop browser and complete it and submit it. And then finally, you can use embedded analytics that basically monitor all user interactions with your forms. And from there, you can determine how many times they hit on the long descriptions to find out more about how to fill out a field, or if they had problems filling something out, or if they just abandoned the form completely. And this really helps you out instead of waiting for consumer feedback. You might have some negative consumer feedback. You can probably deal with that in advance instead of waiting for a phone call or email or a blog post. So how do you create an adaptive form? So you can use a product like Adobe Experience Manager Forms. It is an authoring tool to create digital forms that can be rendered on desktop, tablets, and smartphones. And then it can be integrated with other third-party systems like Salesforce and ServiceNow. It's built on the AEM platform, which is a Java-based content management platform solution from Adobe for building websites. But in this case, you can think of your adaptive form as a web page that actually just collects data. And then with that too, you also get workflow, which will show you how to drive form completion in our consumer story that's coming up. So what's the development process like with AEM forms? Well, Adobe recommends a 4-step process. The big one, and the first step here, is the new AI form conversion process, which we'll show you a demo of shortly. But basically, you can take your PDF form and you send it through this conversion process, and it'll convert it into an adaptive form. And we'll show you how to do that here in a few moments. And then once you have it have your adaptive form, you kind of want to customize it, brand it, make it your own, make sure it fits into your existing website so it doesn't look like you're changing, the forms are kind of branded to kind of correspond with your existing sites. You can also use automated testing. So we use Sauce Labs, but you can use other cloud-based testing platforms. And you can test these devices on other mobile phones and things like that, simulate those tests on mobile phones. And you can script them and help you out there. And then finally, step 4, machine translation. So this is where you can actually take your form and convert it to other languages using third-party cloud services. And we'll give you a demo of that as well. So what is automated PDF conversion? So the big benefit here is significantly reduces the time to convert your PDF forms to adaptive forms, online adaptive forms. It utilizes Adobe Sensei artificial intelligence machine learning technology, which is something that's new for Adobe, and they're integrating it in most of their experience platform solutions. It converts all PDFs into digital mobile responsive adaptive forms that can be rendered on mobile phones, desktop browsers, tablets, things like that. Machine learning auto-detects field types and applies the appropriate validation. So let's say you have a social security number and it detects that it detects a social security number on your PDF form. When it converts it to the adaptive form, it'll apply all the validations for you to make sure that people accurately fill out the social security number. You can also apply styles and themes for consistency during the conversion process. So let's say you have a CSS template, you want to bring that forth into the conversion process and kind of make the forms your own at that point. It'll help you out there. And then you convert many PDFs at a time, so you can support conversion at scale. So this is really important for people who have a lot of PDF forms they need to convert and get them past that hoop of getting it into the adaptive form realm. So we had a large financial customer that had 34 forms that they tested out over a weekend. And what would have taken them, they said what it would have taken them weeks, if not months, they were able to do it in a couple days. So let's see the automated PDF conversion process in action. And you have to forgive me, this is what AEM developers are used to. It's a touch-optimized, browser-based interface, kind of gray, not really exciting, but it's designed to be really optimized in such a way that, there's not a lot of overhead on your browser, but it's very feature-rich. Another thing, too, is in this particular instance, I've also already pre-configured the Adobe Experience, the Adobe Sensei, PDF conversion process as part of this. So let's go ahead and see if this will work for us. So the first thing we want to do is we want to go and we want to upload our PDF into a temporary folder. And we want to preview to make sure we have the right form. And so in this case, this is actually a combed field form that we had for appointing an authorized representative from the marketplace. And we'll go ahead and we're going to check that conversion folder, choose a style and themes. Remember, we can apply CSS templates here as well, so you can brand them to make your own. And then we start this conversion process. And during this conversion process, Adobe Sensei takes over, analyzes the form, and looks for objects, and it actually goes ahead and builds this adaptive form for you. So what you want to do here is you want to preview the form, and you want to make sure that the form resembles what you have, the form hierarchy and stuff like that. So this is kind of the preview of the form before you actually get to the adaptive form itself. And then also, too, here it also generates a JSON schema for you, so you can populate the form and integrate it into your backend system. And here we're going to preview the form. And for this one, I used a we.finance template that I use for most demos. And you can see that we had a 2-page static form, and now we converted it into the adaptive form. And here you can actually work with the form and see if it performs the way you want it to. You can start playing with some of the fields, make sure the validation logics that you're expecting were carried over and stuff like that. And you can also simulate it on mobile phones. This is a really neat feature of AEM where you can simulate your form before you even have a device that you can test it on. So here we were showing you an iPhone 6. And this is like a baking show, so I jumped a little bit further into step 2 here, but I kind of branded this for healthcare.gov. And I divided things up into these different things called fragments. And a fragment is basically something that you can share between forms. So as you create these fragments, for example, like collecting user information like we have here, You can, if you create this one time, you can use it many times in many of your forms. You can also go in and modify each one of the fields, and you can set your exception messages, help text, accessibility text, patterns, all kinds of unique features for that field. And if you have something really unique about this, where you need a really custom validation or some sort of rule, we have a rules editor here that you can go and modify the rules with using JavaScript. AEM is tightly bound with Adobe Sign, which is an e-signature solution from Adobe, so you can digitally sign, submit your documents, and route them to other people for signing. And then the end result here, we can preview the form in HTML, and here's what it looks like. So we added a pop-up modal just for some notifications there. And then we had save and resume that I added there as well, and this is where you come to this point, and you can go ahead and interact with the form and see if it's the way you like it. So a couple things about the conversion process. It's supported, the Adobe Sensei PDF conversion process is supported as of AEM 6.5, which is the latest version of AEM. You'll notice that it is kind of brief there, but it did generate a JSON schema for front-end and back-end integration, but XML schemas are also supported. And also with AEM, you can also bind it to and work with other e-signature solutions like DocuSign. All right. So this is step 4 in our development process, is what is a machine translation? Now, I know there's a lot of things associated with localization, but we're going to just deal with the translation of one language to another. So the big thing here for benefit for machine translation is that you can convert your forms into other languages without converting everything manually. And I've been through this process, and a lot of people have been here in the room here have been through this process, but this can take quite a bit of time and a lot of interaction of sending spreadsheets back and forth in files. So by using machine translation, you can let it do most of it, and then you go and make the minor corrections after the fact. So AEM binds to many third-party custom translation services. It was 30 at the last count that I looked at. Machine translation, like most machine translation projects, they're not always perfect, but manual adjustments can be made in the AEM interface, and I'll show you what that looks like. So the preferred language is determined by consumer browser setting or a button click. So, this is the AEM will flip back and forth depending upon what the preference is, and I'll show you a little bit what that looks like. There's no need to create a new form every time you have a new language, because imagine an adaptive form is kind of what we call a form container. And in that container, it has headers, footers, buttons, captions, fields, stuff like that, right? And then AEM dynamically injects the right content depending upon the language that's preferred. And one other thing too, you can also manually translate everything if you want to. But if you want to pull everything out of AEM and send it to an XLIF file, which is a localization file that you can export out, and you can bring that into other third-party translators, and you can convert it, and you can also bring that back into AEM. So you can do it that way too. All right, so let's see machine translation in action. But before we start here, I just want to bring you up to a topic. It's called, AEM uses something called dictionaries. And dictionaries are a way that AEM uses to externalize content. So the best way to think about that is if you have a pop-up message or even a modal in your application, and you have there's a custom content with that, that custom content is called externalized. It's called an externalized content or externalized string. And so we use these dictionaries as a way for us to dynamically inject the right content, in this case language, into headers, footers, button labels, captions, and things like that. So let's go ahead and start the translation process here. So the first thing we want to do is you want to choose our form. This is the authorized representative form that we converted earlier. And we want to select the target language. In this case, we're going to be choosing Spanish. And then we want to give it a project title here for authorized rep form. And then we want to open up that project, and we want to take a look at the properties. So in these properties, we're going to be looking at, we want to verify our target language, and then we want to say machine translation. And in this case, we're using Microsoft Translator service. And we're also going to define a context, and that's helpful sometimes if you're in a specific industry like healthcare. And then here we're going to give it a brief description for machine translation. We're going to save this, and then we're going to start this translation job. It only takes a couple seconds. It's negotiating and talking to Microsoft Translator service. And when it's done here, we can review the translations. And first off, we can see the baked-in translations for AEM itself, because AEM supports many different languages. But among that, we can find our dictionary specific to our form. And you'll notice we have the English and Spanish side by side. So if you find any issues with this, you can go and make manual edits. Ultimately, the best way is as you want to see it, right? So we get to this point, we want to preview the form. And like I said, it's not always perfect, so you just want to go here. Oh, here's an example of where we use a button click to convert back to, we clicked on Espanol, went to Spanish. Here's where you want to actually look at this to make sure it looks okay. And wherever it didn't convert right or didn't convert at all, then you can go back and make the manual edits yourself. Okay. A couple things about machine translation, just intrinsically. Machine translation is not always perfect, especially with captions and button labels, where the context is not known. But what we usually find out is that paragraphs, sentences, and stuff like that usually convert pretty well. So you'll see that happening. And then also, too, if you're not happy with what you see, you can always export it into an XLIF file, which is a localization standard file format. And you can bring it into other third-party products, make changes to it, and then bring it back into AEM dictionary, and then you got it. So here's some technical stuff for is a tech talk. So how do you integrate adaptive forms into existing sites? Well, the best thing to think about this is that the AEM forms, the adaptive forms you build are entirely hosted on the AEM form server. And the reason why they do this is Adobe technology in the background that reaches out to the devices and find out how this form is being rendered on what device, and it figures out how to give it the best experience. So that's all Adobe technology in the background there. You want to ensure that the styling rules defined by your adaptive form match your parent site. So as people go back and forth, they don't realize there's a big change. So the best way to think about this is that if you go and you renew your tabs at the DMV website, you notice it eventually gets to a payment option, right? So you enter your credit card information. You'll notice that's probably a financial institution website. And you don't even know you went there, but they branded it in such a way that you don't even know you went to a different location and came back. So that's a good way to think about that. You want to make sure the form container in the parent web page uses the entire width window. This is so that Adobe technology has the full rights to control how it's going to be rendered on all these different devices. jQuery is required to render an adaptive form. We use jQuery UI widgets for like fields and buttons and things like that. Otherwise, you want to make sure that you can read jQuery files from a content delivery network or has a local copy of jQuery already embedded. Healthcare.gov, for example, uses jQuery and also jQuery cookies, which is a lightweight jQuery plugin for reading, writing, and deleting cookies. If the AEM server and the parent site are on different domains, you want to enable AEM forms to serve adaptive forms to a cross-domain site, which is a configuration item in AEM. That's not too hard. You also want to set up reverse proxy to enable the communication between the parent site and the AEM form server, and that's pretty standard. You can use URL rewriting to mask the URLs, or even better yet, provide a search engine-friendly URLs for your adaptive forms being served, and that's not too different what you're doing right now with PDF forms. And then you can use APIs and services to pre-populate adaptive forms and receive submitted data. So in the 2018 session, they were talking about, can you send information through a URL and pre-populate the form? Yes, but there are better ways of doing that. You can set up a Java class on the AEM form server, which is a pre-fill service for the form. And then what you could do is when a user logs into healthcare.gov and goes to the AEM form server to render the form, you use an authentication token. and that authentication would so can say, oh, I know who this is, and oh, in this form, I can pre-fill this information for them. So that's more of a secure way of doing that. If you have drop lists and things like that in your adaptive form, you can also bind to web services. So you have a lot of things to choose from. All right. So what's a typical consumer experience like? This is actually based on, this story is based on a POC that was developed for a healthcare.gov appeals team for appointing an authorized representative. It consists of an online experience where a consumer logs into healthcare.gov. They fill out a sign and submit form on their desktop or mobile device, and then the authorized representative signs the form as well. In the background, we have what we call a notification campaign through AEM workflow. And what this does is it tells the authorized rep, they send an email to the authorized rep indicating they need to sign something, and then the consumer receives a text message indicating that the authorized rep is signed. Now, if you're using save and resume features, you can do these nurturing campaigns through AEM workflow that says, hey, you saved something, can you come back and complete this? So you'll see that in the Census 2020. All right. So what is adaptive form being used in this story? For this particular story, we're using what we call a wizard. Remember, again, that's kind of the step-by-step TurboTax-like functionality that we're looking for to help the consumers fill out this form. And this is the one for appointing an authorized representative. It's basically there's basically 4 buckets of information we've broken out for this particular form. So step number 1, we have instructions and we have consumer information. And then each one of these buckets is called a panel. So you can imagine that if you're navigating through a form, you kind of have table of contents and things like that. Those are considered panels. That's just a term we use internally on AEM forms. So here we have step 1, instructions and consumer info. They fill out that information, most of it's pre-filled, and then we validate to make sure it's accurate. Then they go ahead in step 2, and they fill out the information for the authorized representative and validate that that's filled out correctly. Then we go to step 3, and if the authorized rep wants to receive electronic notifications from healthcare from the marketplace, either through text messaging or phone, they sign that. And then finally, we get to step 4, which is the signature page, where they can review the form, sign it, and submit it electronically. And then also, too, they can download a PDF for the records. All right, so who are the people involved in this story? So we have Casey, who's a member of the marketplace, and due to some unforeseen circumstances, she would like to appoint someone to be her authorized representative. And here we have Sophia, who is just Casey's mother, who is more than happy to be the authorized representative for Casey. So how does a consumer fill an adaptive form on a mobile device? So first of all, Casey goes into healthcare.gov, finds the form for appointing an authorized representative, and she's really excited because we use the pre-fill service, and we pre-filled the form for her because she's already logged into the site. And she's able to quickly go through the form, fill it out in the 4 steps that we indicated earlier, and she can electronically sign and submit. And then how does an authorized rep electronically sign a form? So Sophia, who is Casey's mother, she receives an email from healthcare.gov, and she goes in and clicks on the link, and she opens up the form. This looks like a PDF, but it's actually a web form. This is being delivered by Adobe Sign, and basically it's a way for people to sign either on the mobile device or through a desktop browser. In this case, it's a desktop browser. And she's thrilled to see that it's in her preferred language, which is great, right? Spanish. And so she's able to quickly go through the form, and she fills it out, signs it, and submits it as well. Now remember, going back to the notification campaign, so she just filled out this form. Sophia just filled out this form and submitted it. So Casey receives a text message telling her their mother has signed it, and that basically completes the workflow.
Great. Thanks, Wade. So we are more than happy to take any questions that you might have. I know that we're getting a little bit short on time here. So I do want to, just before we take any questions, if we could flip to the next slide real quick, just let you know that we're more than happy to come and give any follow-on demos or have follow-on discussions with you. These are our points of contact. It would take less than a minute to do the conversion. We can do it within the context of your program and your forms. And so our contacts, Katrina Sizemore, who is the core within our MIT group, and then Jody Welch from Adobe, and Jerry Pierce from New Wave. So.
Questions? I know there is one on the phone. Maybe I'll read it for you guys. It says, question for members of MITG. For programs that have pursued solutions such as AEM to streamline application process, how do we ensure that our program needs will be prioritized within MITG and OC as part of this effort? I guess the question, I'm reading it, is more around if another program wants to take advantage of this solution, is that something that they will have to coordinate from a support perspective with MITG, or they just have their separate licensing and they have to get their own support contract? How would that work? I guess that's what I'm reading into the question.
So I think it would be, they would be able to leverage. I think we mentioned on our slide about the licenses earlier that there is an optional CLIN on the current professional services contract, if that's what they mean by support with the question. Then the license is unlimited, enterprise-wide, so any programs within the CMS are welcome to use the technology. With the support with the professional services, there's an optional CLIN on the contract that I believe is also available outside of MITG and SCIO, so enterprise-wide.
Okay. Any other questions, anyone? No? Well, hopefully you got to learn.
Can you hear me?
Yes.
I have a quick question. Are these slides available?
Yes, they are. They are all posted in Zone. And if you go to Twitter and go to CMS Converge hashtag, you get the instructions on how to get into Zone. But it's basically off of the enterprise portal.
Okay. And then the next thing, I sent a message through, I don't even know, maybe email or something. But 6:30 a.m. start time for us over here on the West Coast. If you guys could back it up an hour or two, that would be great for next time.
We will take that into consideration.
I mean, it great session. You know, from what I caught, I couldn't get on until like 7 a.m. But great, outstanding information, especially the fact that this stuff is already, you know, it's enterprise license. So.
Thank you. Yeah, we will try.
Technology.
I know sometimes we are, just so you know, sometimes we got to compete and we got to work on the availability of the auditorium here at the main campus. So that seems to be our biggest challenge for us, but we will try. We will try.
Got it. Got it. Appreciate it. Thanks for the info.
Okay. Anything else, anyone? All materials are in Zone. For external, for internal, everything is in SharePoint. So it's accessible there. This is being recorded, so for the internal, the link for the YouTube link will be also available in SharePoint. So our next session will be on the 20th of next month. So I don't have all the list of all the topics, but we'll be sending emails, broadcasting all the information so you're ready to know what we have so you can attend again. Anything else from the team? No? All right. Thank you, everyone.
Thank you.